I am Jill Wilkens. I'm one of the physician assistants here at Astera Health. Today's bite-sized conversation is this tick bite something to worry about, or as I have been calling it, welcome to my TikTok. So specifically today, we're going to be talking about this tick here. This is what we most commonly refer to as a deer tick. These are the ones that are going to spread disease in Minnesota. This is what I'm talking about. Not so worried about the other states. We can certainly get you more information if you plan on traveling. So starting with this larvae here, it's actually the size of a poppy seed. Very, very, very tiny. These are the baby ticks. They do not typically spread disease. They have not had a chance to get the bacteria that will spread the illness. We move on to the nymphs here. These are the ones that we worry the most about. Now nymphs, they're very, very tiny, and they're very likely to spread illness, especially in the spring and the summer, okay? And then the adults are more likely to do so in the fall. And you can see the female deer tick here, very specific red back. You can pick those out pretty easily. Now, we worry more about the nymphs simply because of their size. Now, with deer ticks, you'll find a wood tick, you see it, it feeds, it engorges, you notice it's there. The deer ticks are only going to stay on about 4 to 5 days. They're going to feed and then they're going to fall off. So you may not even know that you have been bitten. Okay, so just some tick basics because I didn't have another slide that this fit on. They're referred to as Ixodes scapularis, that's the genus and species. May also be known as a deer tick or a black-legged tick. We do not worry about wood ticks. They are not going to spread any of the illnesses we are discussing today. So if you find a wood tick, don't worry as much, okay? They're going to like the areas where you have folds. So when you're looking for these, think your armpits, your groin, behind your knees, the fronts of your elbows, behind your ears, your scalp, and in between your toes are very common areas you will find them, okay? They're more likely to detach once engorged. I want you to remember that, okay? And symptoms can range anywhere from mild to severe. The better your immune system is, the more likely you're only going to have mild symptoms. Oops, then I'm gonna knock over my water. Okay, co-infections with these illnesses that we are discussing can also occur. So these are the 4 illnesses we're going to talk about today. Lyme disease. This is a bacterial spirochete, just meaning that it's got a spiraled shape. Anaplasmosis and ehrlichiosis. We'll get more in detail why I group those two together. They are also bacterial infections. Babesiosis, which is a parasite, and Powassan virus. So let's start with Lyme disease. This seems to be the most recognized illness that we know about. So when we're talking about Lyme disease, it's actually spread by a bacteria called Borrelia burgdorferi. We know it as Lyme disease because it was first identified in Lyme, Connecticut. So it's named after the town where it was discovered. And when we talk about it, we talk about or hear a lot about this specific rash here. It's known as erythema migrans, but most people refer to it as a bullseye rash. I like to think of it as more of a target rash. You'll notice you'll get an area of redness, often then an area of clearing, and then more redness around it, okay? So it looks like a target or a dartboard. When you get a tick bite, you will get a reaction to it. Just like when you get a mosquito bite or a deer fly or a horse fly, you get an area of redness and swelling. The same can be said for a deer tick bite. You may notice like a little scab with redness around a few millimeters. That's a very normal reaction to a deer tick bite. So when we're talking about that bullseye rash, this is what we're referring to. And this is typically going to be the first symptom most people will notice, okay? So when we start talking about Lyme disease and symptoms, we break it down into how long you have had symptoms. So primary Lyme disease is going to be that erythema migrans rash. That's going to be noticed in about 80% of people after being bitten by a deer tick, okay? Then we start to notice muscle aches and joint aches. You can get headaches, sweats and chills. Actual fevers are pretty rare unless you're immunocompromised or you have a bad immune system, or in children we can see fevers develop. And then even less likely loss of appetite and sometimes stomach upset and pain, okay? So Lyme disease is typically going to present about 1 to 2 weeks after you've been bitten, but it can occur anywhere from 3 to 30 days after exposure to the deer tick, okay? So then we move on to secondary Lyme disease, also known as early disseminated Lyme disease. If we leave this bacteria untreated for 6 months or less, so anywhere from that 30 days to 6 months, it can start to progress and affect organ systems. So you may notice multiple areas of that erythema migrans rash. You can get Bell's palsy, which is a facial droop on one side of your face. It can cause an early heart block, which you may not notice other than a slowing of your regular heartbeat, and sometimes we can get numbness in our fingers and our toes, okay? If we continue to leave it untreated, so anywhere from that 6 months to years, you get a tertiary Lyme disease. This can actually start to cause damage to your organs. So you may notice more chronic aches and pains. You can get muscle aches and joint aches. If it spreads to your brain, you can get some confusion. If it spreads to your heart, you can then get a complete heart block at this point, which is a little more concerning to those of us in the medical field, okay? So then the fourth stage of Lyme disease is what's often referred to as chronic Lyme disease. We refer to it as post-treatment Lyme disease syndrome. So in spite of adequately being treated, we can confirm with testing that you no longer have this bacterial infection in your body. You continue to have symptoms. Now, there's still a lot of research going on with this, but it's often thought to be almost an autoimmune reaction. You may notice continued aches and fatigue, but eventually your body's going to heal itself, okay? We see or know a little bit more of this. Following COVID, we see people with long haulers. You know, the COVID is gone, but they continue to suffer from cough and fatigue. This is thought to be a similar reaction related to Lyme disease. Okay, so how do we test for Lyme disease? Well, we work in a clinic, we like to check blood. So there is a blood test for this, okay? We're checking for antibodies, which are essentially your body fighting the Lyme infection is what we're looking for. For Lyme disease, it's what's referred to as a qualitative test, meaning I'm getting a positive or a negative result, okay? So this is different from the other diseases that we're gonna talk about in that once you are positive for Lyme disease, you will continue to test positive for the rest of your life because your body will always have that antibody because it fought that illness, okay? So if I see a positive result, that test always gets sent on for further testing. The specific test is called a Western blot. And basically what that is telling me is this a new or an acute infection, or is this your body's immunity, okay? This is also one of the reasons we don't recommend testing for Lyme disease unless you're having symptoms, because you can have those false positive results if you've never tested positive before, and it really doesn't tell me anything at that point, okay? So treatment for Lyme disease is going to be antibiotics, anywhere from 10 to 28 days of medication, depending on how long you've had symptoms and how severe the symptoms are. First line is an antibiotic called doxycycline. If you cannot tolerate that or have an allergy, amoxicillin is second line, and if you cannot tolerate that, we can use a third or fourth generation cephalosporin, so Ceftin or Rocephin. Okay, Lyme disease is going to be different from the other illnesses we talk about in that there is a means of prophylactically treating this. So if you know that you've been bitten by a deer tick and you meet the below criteria, we can give you an antibiotic course to hopefully prevent it from turning into Lyme disease. So the criteria are the tick needs to be identified as either an adult or nymph deer tick. It needs to be attached for approximately 36 hours or longer. Now this is based on animal studies or studies done on animals that it takes about 48 hours from the bacteria to get from the stomach of the tick to the mouth and the saliva to spread to the host, which is what we are considered. It needs to be in an endemic area, which unfortunately in Minnesota we are considered an endemic area. And treatment needs to be within 72 hours of removal. So I was asked specifically by the emergency department to make this plug. If you find a tick in the middle of the night, it is okay. You have 72 hours to get in and come see me in clinic, and we will help treat that for you. Please do not go into the emergency department, okay? And treatment is going to be with doxycycline, 200 milligram dose, just a one-time dose, all right? So there is no alternative if you do not tolerate the doxy. And this is proven to be about 85% effective based on studies in preventing Lyme disease from occurring. All right, and then here's a map of Lyme disease in our section of the US. You can see how it has continued to grow and spread from 96 to 2018. All right, next up, anaplasmosis and ehrlichiosis. Now these two are often used interchangeably because initially they were thought to be the same illness. Studies now show they're actually two different bacteria, and I'm gonna mess this up, but let me see. Anaplasmosis phagocytophilum, and Ehrlichiosis schafiensis, I believe is how they are pronounced. But I'm not a Latin speaker, sorry. Okay. Now, these typically occur more commonly in the spring and summer months as well, and you will notice symptoms anywhere within a few days to 2 weeks after exposure of these developing. And now, anaplasmosis is going to be the one we see more commonly in Minnesota, although I have seen a few cases of ehrlichiosis here as well. Now, signs and symptoms are going to be similar. You're going to notice fevers, sweats, chills, body aches, and symptoms often will wax and wane. So you may feel ill. It may last for a few days, and then it can go away, and you think, oh, I'm getting better, and then symptoms come back. That's a pretty classic presentation for these illnesses. Let's see here. Oftentimes, people say it's like having influenza, but you don't have the respiratory symptoms. So you feel pretty sick with this if you've ever had influenza. It's not good. And lab work is going to be, well, we check blood. Now with this, we are also checking for an antibody, but we're doing what's referred to as a quantitative test. So I'm getting an actual number of antibodies in your bloodstream, which we can follow down to 0, okay? Oftentimes also, who here's had a CBC done? Everybody that's had a physical, you've had a CBC done. It's a basic lab test that we run on pretty much everybody. What you will see with that is a low white blood cell count and low platelets. So to me, that means viral. But if I have a high index of suspicion, you've been bit by a tick, the CBC comes back in 30 minutes, whereas the tick testing takes a few days, I'm going to treat you based on that. Okay? First line treatment is doxycycline, which is great. Same thing we use for Lyme disease. If you do not tolerate that, second line is an antibiotic called rifampin. And here are our maps. As you can see, anaplasmosis here, more common in Minnesota, whereas we're going to see the ehrlichiosis more in the southern U.S., as it's typically spread by a different tick. But there are a few cases in Minnesota. Okay, babesiosis. This is a parasite called Babesiosis microti. It is more common in the spring and the summer, and typically symptoms will occur within a few weeks. So there's a lot of crossover between these illnesses. Signs and symptoms sound very similar. We're going to notice fevers, sweats, chills, aches, and fatigue. Now with this, we're going to check blood work. We're checking for a quantitative or a number antibody. We can also do what's called a peripheral smear. Because this is a parasite, if we have a pathologist take a look at a bit of your blood under a slide, we can physically see this parasite in your blood work, okay? Yeah, I know, right? Okay, yeah. I don't, thank you. So treatment is a little bit different. Typically, we utilize an antibiotic, often referred to as macrolide antibiotics. So azithromycin or your Z-Pak, that's going to be first-line antibiotic. And then we want an antiparasitic agent. Atovaquone is going to be the most common. It's actually an anti-malarial agent, but malaria is a parasite, so they work interchangeably. If you do not tolerate those medicines, alternatively, we can use clindamycin. Unfortunately, that is also a macrolide antibiotic, so hopefully you don't have a problem with the entire class of antibiotics. And quinine, which is another anti-malarial agent that is very hard to come by nowadays. It's kind of an old school med. All right, so here is our map of the United States, and you can see the areas where babesiosis is found. Not in Florida. Okay, last but not least, the Powassan virus. Now, I've been seeing this one more in the news lately. I'm sure you've all heard of it. This was first identified in 1954 in Powassan, Ontario, Canada, which is how it got its name, and first identified in the United States in 2003. For comparison, there were 54 reported cases in the year 2024 over the 10 states where Powassan virus has been found in the U.S. So signs and symptoms: fever, headaches, vomiting, weakness. This can progress to encephalitis, which is swelling along your brain, or meningitis, which is swelling along the layers of protection along your brain and spinal cord. So this can lead to confusion, paralysis, seizures. So very concerning symptoms. Typical testing is blood work, and if that gets sent out. I had to talk to our lab department. We do not run that test in-house. That will get sent to the Mayo Clinic. We can also check cerebrospinal fluid, which means you've had a lumbar puncture. Not enjoyable. Sometimes we can do imaging to give us an idea of what's going on. We can do a head CT to look for swelling along the brain. If there's enough history and symptoms are concerning enough, that can be indicative of the diagnosis as well. Because this is a virus, we don't have a medicine to make this one go away. Treatment is based on your symptoms. If you're dehydrated, we give you fluids. If you have a fever, we give you fever medicine. Nausea, we give you Zofran. If you have pain, we treat your pain. Sometimes we can use steroids to bring down the swelling, and if you develop seizures, we give you seizure medicine. Here is a map of the counties in Minnesota where cases of Powassan have been diagnosed before. Okay, now we're talking prevention. We in medicine, we like to prevent illnesses from happening. That's why we harp on you about coming in for your physicals and having your colonoscopies and mammograms. So if we can prevent you from getting one of these illnesses, that is our preferred choice. So we're talking utilizing bug spray. Typically that means something with DEET in it, or you can use permethrin-based bug sprays. We recommend wearing pants, long sleeves, and hats. If the bug cannot attach to your skin, that's much better for all of us, right? We recommend using light-colored clothing so that you can pick out those dark or red-colored ticks before they get attached to your skin. If you are going outside and there's a risk of a tick bite, please check yourself following and remove the tick as soon as it's found. It is not recommended for children, no. So then you can use a permethrin-based bug spray, yeah. Yes, there's a lot of controversy around DEET in general, so yes. So removing a tick, please do not douse it in alcohol, please do not light it on fire. We recommend simply grabbing a tweezers and grasping with the tweezers as close to the skin as possible, pulling steadily away from the skin. Once you have removed as much of the tick as you can, please wash the area with warm soap and water to prevent secondary infections. Anytime there is a possibility of an opening to your skin, abnormal bacteria can get in there and infections are possible, okay? Flush it down the toilet, please, Carol. Yes. I mean, what you do in your free time, that's up to you. My last take-home point for today is it is okay if part of the tick remains in your skin, okay? Your body is very good at protecting itself. It is either going to push that foreign object out and it's going to go away, or it's going to absorb it and break it down, okay? You can do more damage than good if you sit there and try to dig at your skin, and then we're going to definitely get a secondary infection. If you come in and visit me in clinic, I'm going to tell you to leave it alone, okay? Here are my sources for this information. Any questions?
Does it help to spray the DEET on your clothing?
That can be better.
Not your skin?
It is okay to spray it on your clothing, yes, especially if you're covered. Okay?
These diseases only spread by the deer tick, not the
Only spread by the deer tick. The wood ticks do not spread these illnesses. Yes? I'm sorry, only spread by deer ticks, not by wood ticks. Okay.
Can I make a suggestion?
Yes.
So if you find one and you're gonna go into the emergency room or into the clinic, put it between two pieces of tape so they can prove.
If you find one, put it between two pieces of tape and bring it in. Yes. You have one. Excellent. And that might be one of those larvae that we talked about. We have a deer tick. I'm assuming it is a larvae based on the size. They're very tiny. Yes. Are you okay if I, okay. You get to start it. Any other questions for me?
You know, you read about prevention, and they talk about taping your bottom of your pants so they don't get up on your legs. Does that kind of stuff make sense?
I think that does make sense, yes. If they can't attach to your skin, that would be good. So if you duct tape it down to your sock, or tuck your pants into your socks, they won't be able to attach to your skin. Yes? You also wrap tape around backwards so they attach to the tape. Yep. That makes sense. Well, how do you find something that tiny was the question. That's the point, is you may not even know you've ever been bitten, so that's why it's being very aware of symptoms. All right, if there aren't any other questions, thank you for your time. Oh,
Generally, where do you find, I mean, they're close to the woods or brush?
so where are we going to find these? They're going to be more common in tall grasses and woods, but certainly we have been seeing them in people's yards, especially if, sometimes it's hard to get that grass cut. So, and they do not drop from trees. No, they're gonna crawl. No. Do they get on animals? Yes. So oftentimes, especially if you have dogs that are outdoors, making sure they get their flea and tick medicine, and that seems to be a common source of them. Because I hear a lot, hey, I don't go outside. Well, but you have pets, and you have a yard, and those are the most likely places they're gonna come from. Can you spray your yard for them? Yes, they do have permethrin-based yard sprays that you can utilize to kind of help prevent them from getting into your yard, similar to what they use for mosquitoes. Pat? They should not be able to drop from trees. I don't believe that. They tend to live in the grass. Yeah. There you go. All right, thank you, everybody.